I'm bringing on someone we know very dearly here at the center, our own clinical director and our own anti-aging expert, Erin Mewshaw. And Erin, thanks for being on. And I know you've looked at tons of different options out there for anti-aging, rejuvenation, all these different things. I want you to just spell out in simple terms, what are people's options outside of Botox that can be considered safer and something they should be looking at?
So first, I want to touch on things that you can do at home. Yes, there are procedures that are more naturally based that will help to increase collagen and elastin, help with fine lines and wrinkles. But first and foremost, the skin is an outer reflection of what's going on inside your body. So there are things that are going to destroy collagen, sugar being number one, dehydration, caffeine, alcohol. These are all things that, you need to keep control of. Cut off the sugar. Do a month or two where you're not having any alcohol. I know a lot of people do like to have wine at dinner, but that's going to impact your skin. A lot of people don't drink enough water. Caffeine, even though people think, oh, it's just a little bit of coffee here and there, but it's a diuretic. It's going to keep you up at night. It's going to impact your cortisol production, which is going to increase your stress levels. It's going to make your skin look dull, tired. You're going to develop bags under your eyes. So these are just basic things that you can do at home. So that would be number one. Number two is sticking to a good skincare routine. So that would be at least a 3-step program. So cleansing, toning, moisturizing every day. If you want to get a little bit fancier, you can add a serum. You can always add night creams. You can do weekly masks. But if you want to know, some procedures that are more naturally based, especially ones that we offer here, I know a lot of other places kind of offer some similar treatments, but the biggest thing you want to do is to help increase collagen and elastin. So there's nothing going to be like Botox where it's going to freeze your muscle. There's nothing like that available. So I'm not here to bash Botox either, but I am going to offer some options for people who want to go a more natural route. So the first thing would be something that's not invasive. So I'm going to start with the least invasive first. So there's something called Dermatude. It's a machine and products that were developed in the Netherlands, and that is called Metoject therapy. So instead of microneedling with needles, it's done with kind of microplastics. And it creates like tiny little micro perforations in the skin that allow the machine to push product in to kind of stimulate collagen growth factors, but also help depending on the product line that's used. So they have multiple serums, whether it's for hyperpigmentation, hydration, stem cell renewal. And so sitting with somebody who's, a professional to look at your skin to kind of analyze what your skin needs, because there is no kind of one size fits all treatment. That would be number one. That can be done every 2 to 3 weeks. Another one would be microneedling with PRP. So that's going to be a step above the Metoject therapy because that's done with sterilized needles. That's actually going to cause a break in the skin. You're going to see some bleeding. So microneedling on its own is going to also increase collagen, some growth factors there, help build and treat elastin. But if you want to take it even a step above, we can do PRP with it, which is where we pull your blood out. We spin it in a centrifuge. We're going to separate the red cells from the plasma. We're going to take that plasma, which is full of growth factors, and rub it onto the skin after we have needled your skin. So it's going to help push that PRP deeper. So think of the Dermatude, but kind of on steroids a little bit. So that's not done as frequently. It's done, maybe once a month, every 6 weeks. You're going to be more red afterwards. You're going to have a few days of downtime, whereas the Dermatude, you can leave, you can go out afterwards. You're not super red. And then if you wanted to be a little bit more aggressive, you can also, in between your microneedling or Dermatude appointments, you can throw in a laser. So we offer a really great laser from Israel. The company is called Alma. It's called the ClearLift. It's a Q-switch laser. It's going to go deep beneath the epidermis and kind of create ablations underneath. So it's non-ablative on top, meaning it's not going to take off any skin. You can leave directly afterwards. You're not going to be super red, but it's going to create these perforations deep beneath the skin so that collagen kind of rushes in to rebuild. So it's kind of stimulating it from the inside out versus the other treatments that are doing it directly on top. And that only takes about 15 to 20 minutes. That's done every 3 weeks. Obviously, you need a good cycle of those. You can't just do one and expect to receive a great benefit. You need to do a good series. So we're talking at least 6 to 8 treatments. And the other thing I'm going to mention, which is really big because it's kind of controversial in, I want to say more of the integrative field because everybody knows how toxic sunscreens are. However, we have tested some that are more safe. Please, whatever you do, wear sunscreen in the sun. That is going to age your skin faster than anything else. And I know you're shaking your head at me, but the skin damage you see in your 40s and 50s, that occurred in your 20s. So, everybody needs to be very careful, even if it's cold outside and you don't think you're getting any sun exposure. That's really important.